It's not uncommon for a woman to have dense breast tissue. So take a look at the differences. This is considered a fatty breast, so low density. Now over here in this image, you can see more white. That indicates a higher density. When that's the case, when a woman has dense breast tissue, it can be harder to detect breast cancer with traditional 2D or 3D mammogram. But what about an MRI? That's what researchers at Bronson Hospital are trying to determine, and they're already seeing positive results. Two black and white images. Side by side, they look very similar. But a closer look reveals a potentially life-changing difference.
There are two problems with women with dense tissue. One is that it's harder to see things, and the second is that they have a slightly increased risk of breast cancer.
That's why Bronson Hospital and the West Michigan Cancer Center are participating in a national study looking at breast MRI as a screening tool for women with dense tissue and comparing it to tomosynthesis or 3D mammogram.
MRIs look at the tissue in a different way because we inject contrast material. Tumors usually take up dye. They have blood flow that's different than normal breast tissue, and so that makes them show up almost obvious on an MRI where they could be invisible on a mammogram. So you can see here without the dye, you can't see it.
Dr. Christina Jacobs says the risk associated with a breast MRI is very low for the patient. They're only about a year into the study, but so far, she's impressed with the results locally.
We're getting good quality exams. I'm comfortable with us reading them. They're quicker and easier to read, and we have found one early cancer.
That's one person getting treatment sooner and hopefully one life saved. Here's an example of what doctors were able to see. On the left, you're looking at tomosynthesis. On the right is a breast MRI. We've circled the area of concern on each image. Because of the dense tissue, the cancer is harder to see in the image on the left, but in the MRI on the right, there it is. Again, the hope is to spot these issues earlier, but as the study moves forward, doctors and researchers also hope they'll be able to determine if this process produces false positives, something they don't want for a patient.
If we show that the MRI is finding more cancers at stage 1, stage 0, then you can infer that it's going to be a survival benefit.
So what's next? Dr. Jacobs says this study is actually fairly small. Once patient data is collected nationwide, those results will determine if this is something that should be pursued on a larger scale. It's also important to note that 2D and 3D mammograms are still effective screening tools for all women, including women with dense breasts. But this study is certainly something we will be keeping an eye on. If you are interested, Bronson is currently still looking for women to participate in the study. To learn more, we'll have contact information for you on our website, wwmt.com. In the studio, Erica Moke, News Channel 3.